herbal therapies you can use with people, and you're limited in this study to just 7. Is this a fair test of Tibetan medicine?
This is a good pick. These 7 should indicate, I'm confident they will indicate, that there is something effective here that can really help alleviate the cancer.
Come on.
Summer, the groundbreaking study begins. Teresa and Marita are ready. They know the rules. No treatment except the herbs. If they get worse, guidelines require Dr. Tripathi drop them from the study so they can pursue other help. But if the tumors shrink or just stop growing, it could be a critical sign that the herbs are working.
If everybody has stability of their cancer for, say, a year of therapy, then I think that would be very interesting, because we normally wouldn't expect something that's totally inactive to keep everybody's cancer from growing.
Both doctors have put their reputations on the line for this study, but far more hangs in the balance for the patients. The time has come for their first meeting with Dr. Dhonden. Both women are excited, nervous, a bit in awe.
I've never felt so humbled in my entire life.
Your blood is good.
This is medicine that's over 2,000 years old, but to me this is a practice that's 1 hour old.
Dr. Dhonden's English is limited, so a translator attends every session.
Your particular cancer relates to the wind system, which is very closely related to the nervous system.
Dr. Dhonden prescribes the herbs, then orders something else. Critical changes in her diet.
Number 1, tobacco of any sort that's out, okay? In addition to that, any kind of food that is prepared in such a way that becomes sour. And in terms of meat, you should avoid chicken.
On top of giving up poultry and sour foods like vinegar and pickles, Dr. Dhonden tells all his cancer patients to cut down on sweets and avoid alcohol. Tibetan physicians believe certain foods upset the body's balance, and most patients, no matter what their ailment, are told not to drink coffee because it's considered a harsh substance that aggravates the blood.
I felt a very strong energy, and when he took his hand off of my wrist, the energy left.
You've been through all these tests, right? Blood tests, lab tests, all sorts of machinery, all sorts of doctors. Now somebody says they're going to stir your urine and take your pulse. Did you at any point think, this sounds a little out of this world?
It wasn't difficult for me because I have exhausted all Western medicine. I have no other options right now. So for me, it was the most natural progression. That turn was very easy.
It's now Marita's turn. Dr. Dhonden feels her pulse and then looks at the urine sample.
The doctor says the urine indicates that there's no unusual sediment. There are no really bad characteristics or indications of danger here.
The exam hardly lasts 10 minutes before Dr. Dhonden prescribes Marita's herbs, then encourages her to recite a Tibetan prayer. A spiritual practice Tibetans believe helps the body to heal. And before she leaves, the same strict diet instructions Teresa received. In particular, no coffee, so the herbs can do their job. Routine orders that will later change the entire course of Marita's treatment.
So this is the very first dose?
Yeah.
It's also foreign. Nothing of the exam or the treatment is like anything Marita has ever seen before.
These little silly-looking pills that I have to bite into is my total cancer treatment, nothing else.
After all you've been through, it boils down to that.
I hope it affects the pain, first off. I'm tired of taking pain medication.
It made us wonder, now that he's seen both women, and remember, they have stage 4 breast cancer, nothing in Western medicine can cure them. Does Dr. Dhonden still believe he can help?
Teresa Wilhelm, what is her condition and your prognosis?
The cancer has spread a lot, and so that's going to make it slower to treat effectively, but I do expect to see improvement as she continues to take the medication over the coming months.
And what about Marita, whose breast tumor is as big as a large lemon?
If she takes the medication as I prescribed it, and if she follows the other advice, especially pertaining to her diet, her behavior, if she follows that, I think she'll be healed.
Now, you're not just talking about better quality of life or more time. You are talking about the cancer being gone.
No, I don't quite mean total cure. In fact, she'll have to take medication for the rest of her life.
Are you talking about a normal lifespan for her?
I do believe that she could live out a normal lifespan.
It's an almost unbelievable prognosis based only on her pulses and urine sample. In fact, during the study, Dr. Dhonden discovers a kidney infection in another patient who was totally unaware of a problem. Dr. Tripathi admits Dr. Dhonden's methods baffle him, but he's impressed with the monk's uncanny diagnostic abilities.
He has picked up parts of a patient's history or their clinical diagnosis that he would have not known otherwise simply by looking at their tongue and examining their pulse.
But will Dr. Dhonden's results be as skillful as his diagnoses? He'd predicted Marita would feel much better in a few weeks. But 2 months into the study, when we check in on her at her home in Modesto, California, she says her tumor is bigger.
The breast is continuing to become disfigured and discolored, and the lymph nodes are continuing to get larger.
And there's another problem. Dr. Dhonden's diet rules are much tougher to follow than Marita had ever expected.
I love strong coffee. Dr. Dhonden would like me to stop that, and I still occasionally take a glass of wine, which I should be stopping that. So I'd like to say I am a perfect student, but I'm not.
At the same time, 2 months into the therapy, we see Teresa. Dr. Dhonden is reserved about her prognosis, but we found her with her family in Hemet, California at the top of her game.
The second time I went through chemotherapy, I decided to get a mohawk. I take the herbs 4 times a day, and I'm feeling great. I have a lot of energy. Well, in fact, I have never felt better in my entire life.
Plus even more good news. Teresa's high blood pressure is now normal, and the tumor on her chest wall feels smaller.
And it's the first time in 2 years it's decreased in size. Just a little, but it's digressing rather than, increasing. So that's pretty substantial. It's good news. I haven't had good news in a long time, so that's been real positive for me.
But the real test, the one that counts most, is still 2 months away when Dr. Tripathi takes a look. Right now, neither woman knows the greatest challenges yet in their long, exhausting fight for life are just around the corner.
Returning to our story, it's a day fraught with emotion for the 2 women with breast cancer we've been following. With Western medicine offering no hope, they've given themselves over to a doctor from the East, a doctor who's asked a lot of them, but who has given them the most important thing, hope. They've taken the herbs he's prescribed. Now it's time to find out, are they working? Again, Margaret Larson.
Well, chips ahoy, mateys.
It's been 4 months since Teresa Wilhelm reached beyond Western medicine to trust her health to Tibetan herbs. And as far as she's concerned, it's a gamble that's paying off.
This is the first time in several years that I am seeing, some positive changes. I don't know if these herbs are going to affect the length of my life, but I know that I'm affecting the quality of my life.
So do you think there's actually been an emotional component, a spiritual well-being component to these herbs?
Absolutely. My family has noticed it. I notice it, which is mine, honey.
But does Teresa feel better just because it's a new treatment, or are the herbs really working? Dr. Dhonden arrives from India to give all the patients on the study, including Marita and Teresa, their first checkup since starting the herbs. Dr. Dhonden's face is impassive, giving Teresa no clue about what her pulse reading tells him. There's growing tension in the room, and his questions reveal he's discovered something Teresa hasn't told anyone.
Do you ever feel any kind of shooting pain? It's brief, and his finger gesture was kind of like this. Just kind of a shooting pain that comes and then vanishes.
The past month I've had a dull shooting pain under my right arm. And
pain is sometimes a sign that cancer has spread. Is this what Dr. Dhonden senses? It's one of Teresa's biggest fears. It is a nervous wait as he moves on to check her urine sample.
Would you ask Dr. Dhonden how he feels I'm doing compared to 3 months ago to this month, if I've improved or what he feels?
Yeah. generally speaking, you're getting better.
That's Dr. Dhonden's opinion based on Tibetan theory. But will the sophisticated high-tech scans lead Dr. Tripathi to the same conclusion?
Good morning. Hi, Teresa. How are you doing?
Teresa is clearly anxious to know what he thinks.
So the main areas that we know have been involved, those are all stable.
It's a victory, or at least a reprieve. The pain is likely just inflammation or a tiny bone fracture. It is not linked to cancer growth. The tumors are no worse. Teresa heads home, for now relieved, cautiously optimistic.
When we spoke last, you said, bottom line, what you wanted was more time. Are you closer to that now?
And I think I answered you. I want to see my daughter graduate from high school, and I want to see my grandchildren. Well, it has changed. I want to see my grandchildren's children now. So yeah, it has changed.
Yeshi Dhonden.
For Marita Brown, it's clear Dr. Dhonden will not have such good news. Marita confesses she still drinks some coffee, beer, and occasional wine, even though Dr. Dhonden told her to stop. His exam confirms what Marita already suspects. Her tumor is much worse. Then the shocker. Because of that, she is off the study. Dr. Dhonden is not pleased.
You had the best prognosis, and now you're off the study, and what undermined it was your coffee and the beer. That really, really did it. It completely overwhelms and overshadows the efficacy of the Tibetan medicine. But if you continue to take alcohol of any sort, hard liquor or beer, if you continue to take coffee, then you're wasting your time and you're wasting his time as well. It will not work.
It is a devastating blow.
I figured one beer or 1 cup of coffee a day can't be that harmful.
So what do you think now?
I made a misjudgment out of my own fear that I couldn't handle what I'm going through without this crutch of caffeine.
When I press down, does that hurt?
They're sore.
Okay.
Dr. Tripathi confirms that Marita's scans show the tumor has grown 36% in the 4 months she's been on the herbs. Once the size of a lemon, it is now the size of a grapefruit.
Well, since we know that there is progression and you're coming off this study, you could still continue to take any alternative therapy off a study that's available to you, and that includes continuing to see Dr. Dhonden.
So at this point, Marita faces an unexpected and wrenching choice. Continue with the herbs or surrender to the aggressive Western treatments she's fought so hard to avoid.
I'm not ready to give up my commitment to these herbs. 3 months to me is just a drop in the bucket.
Marita decides to stay with the herbs and forego any other treatment. Despite her shock at being dropped from the study, there is a silver lining. Dr. Dhonden can now treat her with any of his herbal formulas, not just the 7 the FDA allowed him for the clinical trial.
You see him on Monday and take these new medications and keep your diet strictly, as he's told you, you'll see benefit in 3 weeks. You'll see clear benefit yourself.
According to Western medicine, the herbs didn't work for you right now.
According to the Western way of assessing, according to the Western lens and perspective, yes, you're right. Little changes do not throw me off because I'm looking at the long-term process. That's the value in Eastern medicine, in my opinion.
But Marita's calm, almost detached approach to her advancing cancer doesn't last. And by Christmas time, Marita takes an even steeper turn for the worse. Despite Dr. Dhonden's personally tailored herbal therapy, she says she can barely hang on.
I sleep a lot and have no energy, and many days it's hard for me to even get up to eat.
It is one of her darkest fears, a spiral into disability or death. What if she couldn't manage it this time? Dr. Dhonden repeatedly adjusts her prescription, but the pain just intensifies.
He said at the time that within 2 or 3 weeks she'd be feeling much better, and be on the road to healing. Did it happen that way?
No, it didn't, which threw me into more fear and depression.
Marita had already been down. Now she's despondent. She clings to a close circle of friends who pray for her healing.
Healing power is present.
Had Marita miscalculated in trusting the herbs? Was it time to give in and at least try Western therapies, even if it only gave her temporary relief?
Okay, we have our seatbelt.
Hundreds of miles away, Teresa Wilhelm, who had been doing so well, is alarmed. she too has suddenly nosedived.
My hip was inflamed and it hurt and I couldn't bear weight on it.
Then a horrible development. After being so active, teaching water aerobics, riding horses, the old pain in her hip becomes almost unbearable and forces her to use crutches. And the fear is even worse. What if the cancer is growing again? What if she can no longer take care of herself?
Oh my God, what could happen to me? You know, I'm picturing all these things, like I'm designing wheelchair ramps in my house.
It is the cruelest of moments for both women who'd already endured so much. The faith and hope that started them on Tibetan medicine is now severely tested. But the study is only halfway finished. Every day they wonder if they'll survive the next 6 months. It is the scariest waiting game imaginable.
And now the conclusion to our story. Both Teresa Wilhelm and Marita Brown have put all their faith in Dr. Dhonden and his Tibetan herbs, and both have reason to believe that this, their last chance, is failing too. They're feeling sick and scared. Now, after a year on the herbs, the moment of truth, will their faith be rewarded after all? Once again, Margaret Larson.
It's the new year, 2000. While many of her friends nurse the hangovers of a new millennium,
Scoot you over here.
Teresa Wilhelm fights a fresh battle with an old enemy, paralyzing pain.
And breathe.
It could mean the tumor's getting bigger. It could mean I overdid. It could mean a lot of things.
But it certainly means Teresa is scared.
I need you to lie down on your back with your head here and your feet right down there for me. Okay?
And miles away, Marita Brown is also gripped with fear. She can feel her tumors growing. The question today is by how much?
It looks like there's a lymph node right there.
Dr. Dhonden has given her new herb formulas designed just for her over the past 3 months. Yet her pain is out of control. Most days, depression locks her inside her house and keeps her in bed.
From the Western perspective, things are definitely getting worse.
Increasingly, she relies on still other alternative therapies to cope, even wearing a special vest to hold a heavy magnet over her breast tumor.
What they call medical grade magnets, and that helped with the swelling, inflammation, and pain more.